Come in.
Hello, my name is Kirsten. I'm going to be your student nurse for today. We're going to do your head-to-toe assessment.
Okay.
First, to start off, can I check your name and date of birth, please?
Yep, John Sableton, 5/14/82.
Okay, great. And then, are you in any pain?
Nope.
And do you have any allergies?
Nope.
Okay, I'm going to make sure to provide privacy. Pull the curtain. And then I'm going to go wash my hands. Alright, so I'm observing the patient, the overall hygiene, and noting any signs of illness, which he does not perceive to be in. He's sitting up straight. His mood and affect are congruent. His grooming and hygiene, he doesn't have a bad smell or bad odor coming from his mouth. He is dressed appropriately for the weather. And I'm going to ask you a few questions.
Okay.
Do you know the date?
Yep. February 16th, 2016.
Perfect. You know, the beginning of the year is a little tough. And can you tell me where we are?
Yep, Ferndale, Michigan.
Okay, perfect. So I was listening to the patient's speech, and he has fluent speech. He doesn't have any stuttering. And also, he was alert and oriented ×3 to person, place, and time. Next, I'm going to move on to the patient's face. I'm going to look at him and his eyes. Can I pull down on the conjunctiva and check the conjunctiva? Very good. It's not red. There's no excessive tearing. And then I'm going to look at the patient's skin. I'm going to check for any temperature issues, check for rashes, masses, any lesions. His temperature and his color of his skin are normal. His skin color is appropriate for his race. And if there were any lesions, I would do the ABCDE, which is asymmetry, border, color, diameter, and elevation. And next I'm going to continue with the face. I'm going to ask you to close your eyes, please. And can you feel this?
Mm-hmm. Yep. 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 Yep.
Great. And also his eyes are symmetrical. And then can you smile? Can you frown? And sorry. And puff out your cheeks. Perfect. So I tested his cranial nerves number 5, trigeminal, cranial nerve 7, which is facial. And next I'm going to test your eyes. So if you could please look to the corner and then look back at my finger. Good accommodation. And then I'm going to have you look at this pen light and follow it only with your eyes. Very good. And then if you just look straight forward, I'm going to shine a light in your eyes to check. Make sure your pupils are dilating. Very good. So we call this PERLA. Pupils are equal, round, reactive to light, and accommodation. Next, we're going to move on to your mouth. So I'm checking the external features. We already checked the line of your face and symmetry, and everything looks good and in place. So the outer lips look pink and moist, no dryness. And open your mouth and say ah.
Ah.
Okay, I'm checking the dentition, the posterior pharynx, the symmetrical rise of the uvula, the dentition, the gum, the buccal mucosa, everything looks moist and pink. And the tongue, can you stick out your tongue? Okay, the tongue looks good too. And then moving on, we're going to palpate the neck. So one at a time. And the carotids, good carotid pulse. Great. And next I'm going to listen for bruits. Hold your breath, please. Okay. You can breathe. And then hold your breath again. Okay, very good. Bless you. Do you need a tissue?
Okay.
Okay. Next, I'm going to move on to the cardio aspect of this. So I'm going to listen to your heart sounds. This is the aortic. This is the right sternal border and the second intercostal. Pulmonic is the second intercostal left sternal border. and this is where S2 is her loudest. It's at the aortic on the top of the base of the heart. And then we're going on to Erb's point, third intercostal left sternal border, tricuspid, fourth intercostal left sternal border, and the mitral or the apical, which is left sternal border, or it's midclavicular, fifth intercostal. And I would hold it here and listen for the apical pulse for a minute. And then switching over to the valve, we're going to go backwards. The mitral or apical, tricuspid, Erb's, pulmonic, and aortic. So again, S2 is heard loudest at the base, and S1 is heard loudest at the apex. Okay, since we're already doing the anterior, I'm going to continue to auscultate and listen for your lung sounds. Go ahead and take a deep breath in and out through your mouth. And then louder. Very good. If you don't mind, turn this way, and I'm going to do the back as well. Go ahead and take a deep breath. Very good. I heard no adventitious sounds, no rhonchi, rales, wheezing. Everything sounded like good, normal breath sounds. Now I'm going to assess the curvature of the spine, make sure it's in alignment, which it is. And then I'm also going to assess the AP diameter, make sure it's 1 to 2. And then also while we're back here, I'm going to percuss on your back and let me know if there's any tenderness, okay? Any pain?
Nope. Nope.
Okay, and this is in the costovertebral angle. Go ahead and turn around. Actually, I'm going to have you lay back.
Okay.
Great, thank you very much. I'm going to do the abdomen assessment. So I'm going to pull this up. And then first is an inspection. So I'm going to inspect and assess the contour of the abdomen. There's normal pattern of the hair, and there's no scars. It looks round and no abnormalities. So after you inspect, I'm going to auscultate, starting in the right lower quadrant, and listen for a bowel sound. Okay? And then the right upper, left upper, left lower. And I heard bowel sounds present in each quadrant, and if I didn't, I would listen for 5 minutes. Next is the palpation. Make sure my hands are warm. Just light palpation to assess for tenderness in the right lower quadrant. It's the male spermatic cord and the appendix. The right upper quadrant is the gallbladder and liver. The left upper quadrant is the stomach and the spleen, and the left lower quadrant is the sigmoid colon and the left spermatic cord. Okay, thank you very much. You can go ahead and sit up. Next, I'm going to assess the skin again on the lower extremities and make sure for temperature, skin, hair pattern, make sure the skin is nice and moist, not too dry, not too warm or diaphoretic, and everything here seems great. So next I'm going to go to his hands, and I want to make sure that there's no clubbing. So check out the nail shape, and then the capillary refill is less than 2 seconds, which is good. And then can you grab my hands? Very good. So then back up here, we're going to check for the brachial pulse bilaterally. Okay, that's about a +1, and his radial pulse is a +2. Thinking now, I did not grade your tonsils, so can you please open your mouth again? Say ah.
Ah.
All right, his tonsils are about a +2. Thinking of grading. Okay, next, we're gonna continue with the lower extremities. I'm gonna feel for the popliteal, or the tibialis posterior. Good, a +2. And then the dorsal pedis, +1. And then while we're here, we're also gonna check for edema. And there's no edema in this leg or this leg. Good, and then I'm gonna check for the Babinski reflex. Very good. Okay, sir. Now, I'm gonna ask you to please stand up. So this is the get up and go, making sure he could stand up with no issues, no problems, not falling over. He's standing up good. So next I'm gonna have you close your eyes, and I'm gonna assess for a Romberg test. Make sure he's not swaying right and left. And he's good, he's standing normally. Okay, great, you can go ahead and sit back down. And thank you for letting me complete my assessment on you.
Very good.